A rare respiratory illness known as enterovirus D68 is now in New England.
As NBC 10's Susie Steimel reports for you tonight, there are already hundreds of cases of hospitalized kids in the Midwest, and now Rhode Island doctors suspect it's here too.
The rare respiratory illness that spread through the Midwest, hospitalizing hundreds of kids, is suspected to be here in Rhode Island.
Yeah, right now that we've been preparing to have a surge in respiratory illnesses that are expected since school is back in session now in the Northeast.
Dr. Michael Smith of Rhode Island Hospital says enterovirus D68 affects kids under the age of 18, as most adults are immune to it. It's particularly tough on children with a history of breathing troubles like asthma or wheezing. Symptoms are a lot like the common cold. Some have fever, runny nose, or coughing, and eventually trouble breathing. In severe cases, patients with trouble breathing end up in the ICU.
It's difficult for them to breathe, painful for them to breathe, and then when they test the level of oxygen in their blood, it's lower than usual.
Over this weekend, we noticed there was an increase in respiratory infections in our local emergency rooms.
Dr. James McDonald with the Department of Health says they were expecting this. As kids head back to school, these viruses can spread quickly. He says it could be a while before they can confirm these infections are in fact enterovirus D68.
We have to send them down to Atlanta to get the results, so it might be as much as 10, 14 days before we know for sure if there's enterovirus D68 in Rhode Island.
He's urging parents to get ahead of the illness and keep kids who aren't feeling well at home. The disease spreads like the common cold, so washing your hands and using hand sanitizer can make a huge difference. In Providence, Susie Steimel, NBC 10 News.